is very important for us to really start about what's happening in the face. As
Okay.
we all age, it's pretty much the same scientific facts across the board. And I think it's important to actually understand what's happening so that when I offer you the different alternatives, you're able to make the decision that's right for you based on how you understand what's going on in the aging process.
Okay.
All right, so number one is that there's volume loss. Number two, there's gravity.
Okay.
Every part of the face is either having some kind of volume loss, which is thinning of the skin, loss of facial fat, and then lastly is gravity. Gravity, like everything else, makes everything sag, like you said. So if we start in the upper third of the face, the skin starts to thin, which is those fine wrinkles, which are the forehead lines. The middle lines between the brows, which I usually sometimes call the wife lines, adult husband lines, or children lines, or significant other lines.
Yes.
The crow's feet, which are the fine lines across the eyes. So that's what happens to the skin, it gets thinned. Not much to do about those other than what we've all heard about, which are neuromodulators, which is a fancy term for Botox, Dysport, or Xeomin. So those are those options.
Okay.
In the middle part of the face, in the neck, this is truly where we start to look at the face as aging or feel like it's not something that we recognize in the mirror. What's happening is that this portion of the face, this portion of the fat, which is this triangle fat pad, as it loses volume and you start to have some gravity loss, you start to have four changes. Number one is, at one time when the cheek was quite high, as it drops, you feel like you have an orbital hollow or hollowness under the eyes. Number two is that smile line.
Right.
Number three is the frown line. And number four is some neck skin sagging here. And that's because of the gravity that comes down. So every treatment option has to either A, return volume, or number two, fight gravity. Options include fillers, which we've all heard in the media.
Right.
They're safe, some are permanent, and some are temporary. Fillers can be injected under the eyes, in the smile lines, in the frown lines, and around the cheek to try to give that volume back, and by filling volume, you can actually fight gravity.
Oh, okay.
And gives you a rejuvenated or refreshed look. There are also some options that are technology-based. There's ultrasound, which causes the skin to tighten, and also cause a little bit of a lift and volume. And then, of course, lastly, we have to talk about is the surgical option. The surgical option for true facial aging is a face lifting and neck lifting procedure. I like to perform as minimally invasive surgery as we can, and each patient is different.